This is John Pye recording the sheep's heart from the internal and the external view. At first, we will start with the external view. We will always use our main heart as our point, and we will use our scalpel to help us point to the main parts. Okay? Safety is always number one. We always want to make sure that our environment is clean, and that's what we do with the wipes. Number two, we must always make sure that we have gloves on, which I do. And then lastly, when handling sharps, we always want to make sure that we have it always capped. Okay, the sheep's heart. From the external view, we're going to start from the top. The brachiocephalic artery is right here, and that is easy to find because of the fact that it's right next to the aorta. The aorta is always our point of reference. From having the aorta, we can move down and be able to identify the pulmonary trunk, and then also the left atrium. And as we move down, we are always able to find the left ventricle. So we know that the atrium is the top of the heart and the ventricle is the bottom of the heart. Now, moving on to the left side, we're able to see the superior vena cava. And then moving through, we're able to see again the left atrium and then left ventricle. Something new, which is the AV groove. That is something that is not seen all the time and is right in between the AV groove. Now, from this point, as we zoom closer, we're able to come and look at the super anterior ventricular sulci. And we learned that from previous lesson about the sulci. Now, the apex obviously is the bottom right here. So it's very rare that we are able to see the heart from a three-dimensional point of view, which is the anterior and the posterior view. From the posterior view, everything shifts over. What was on the right goes back onto the left. So we can see that the pulmonary veins are on the left side here, and the superior vena cava has moved over here when it was on the other side. And so when it's superior, we know directionally we're able to look again for the inferior vena cava, and then of course the apex. So the posterior view doesn't have as much, but what this really does is help us understand how oxygenation works. We again look from the right side to the left side, deoxygenated to deoxygenated. And we know that from the pulmonary veins, we're moving to the left atrium. So transitioning from the external view to the internal view, we could see that our safety is still paramount. We had changed gloves. We had recapped the blade, the scalpel blade, after we were able to effectively dissect the sheep's heart. We're going to look at the point of view again. This is the internal view, the left side and the right side of the heart. And we're going to use our picture as a guide. So as we can see, the heart is side by side. And so now we're going from the right side and looking to the left. Okay, so we're going to use our first on the left side. We're going to say this is the left ventricle. And then moving on, we always find our landmark, which is the aorta. Now, as you can see, traveling down the tricuspid, we're able to find the right ventricles for both sides of the heart. And also the intravascular septum. See, the intravascular septum is right here, this big piece. The intravascular septum is also on this side. So moving over to the other side, we are able to get more detail because we know that the atrium, which is right here, is able to tell us which side is the oxygenated and the deoxygenated side. And we again, as review, we know that we are pumping from right to left, deoxygenated to oxygenated. So then we're able to get a clearer view of the left atrium and then our mitral valve right here, this little groove right here. So with the mitral valve, as we move on to our description here, we know that that's the left AV, while when we're looking at the tricuspid, that is the right AV. Now moving down, we've already discussed the ventricles. So now we're going to talk about the chordae tendineae. Right here. Okay? The chordae tendineae. I'm trying to not touch the heart more than I have to cross-contaminate. So I'm just pointing in the area. Next, we're going to look at the papillary muscles. The papillary muscles are a little harder to find because they're more embedded. We're able to go inside of it and see. See how the papillary muscle is more embedded. So this is where we're able to use the papillary muscles to help us. As far as contraction and pumping and delivering blood and oxygen. The bottom, as we get closer and closer, is a myocardium. Right about here is the myocardium. So then both bottoms, obviously, again, this is the apex and this is the apex. Now let's look at some similarities and some differences. And we'll use our gloves as a pointing device. If you look at the walls from here, doesn't look like a lot of differences, but in reality, the right side is usually the stronger side, the side that does more of the pumping. And also, we understand that the thickness of the walls, we gotta look at that. And we would say that the right side of the wall is also thicker because of the amount of work it does. Now, with the inside, as you can see, the left side is more shallow, as the right side has a deeper. So this just means it could feel much better. Okay? So let's talk about the myocardium. The myocardium is so much thicker, as you can see, just by looking at the two ventricles. The two ventricles are right here, and then you can see that the myocardium by itself, just this piece right here, is so much thicker. Well, we understand that we have myocardium, endocardium, and pericardium, and that's the three parts of the heart. And we want to make sure that the strongest part of the heart, the myocardium, the muscle, is able to effectively pump. Now here's something just from nursing and general knowledge, is that we understand that the atrium, right up here, is the systolic, and we understand the ventricle is the diastolic. But we also know that the systolic will always be higher than the diastolic to give us the effective pulse pressure. Now, if we have such a big difference, such as a 160/80, that's a pulse pressure of greater than 80, that means the myocardium may not be functioning as well. And that's another way to look at why the myocardium is thicker than the usual ventricles, because it has to work for both sides. So to wrap this video, we want to make sure that number one, we are always safe in disposing of the heart. We're going to go ahead and wrap it back up. We're going to clean the surface, and then also we're going to take off our gloves and wash our hands. This is John Pye, and this concludes the video.